everyone. I'm Alicia Menendez. It is 2 o'clock on the East Coast, 11 a.m. out west. We begin this hour with the coronavirus pandemic and the dire situation in New York City. More than 600 people died in the city in the last 24 hours, bringing the death toll to more than 2,600. That's nearly the same number of people killed at the World Trade Center on 9/11. The United States has more than 290,000 cases of COVID-19. More than 7,800 people have died nationwide. We'll hear from the White House Coronavirus Task Force this afternoon at 3:30 Eastern. And in just a few minutes, I'll speak to New York Senator Chuck Schumer about the ongoing crisis in his home state and what more Congress can do to help. In New York, the epicenter of the coronavirus, emergency alerts were sent out to cell phones on Friday, asking all healthcare workers to assist facilities in need. So far, 82,000 people across the country have volunteered, but Mayor Bill de Blasio says the city needs an additional 45,000 health professionals. Across the country, doctors and nurses are enduring long hours, fearing for their lives and their families' lives as they take care of us every day. Here is more of what they're experiencing on the front line.
We've had tens of patients who have been hypoxic. A few have been intubated. Earlier, we had a patient who had cardiac arrest. It's insane.
This is too much. I don't know how much longer I could do this.
It's very hard to lose a patient that you've been fighting for. And we had 3 heart-rending discussions with patients' families.
I said, I'll try. I'll do the best that I can, but I don't know. She was like, do you have a child? And I said, I do. I'm an 8-year-old. So she's like, so then you know. And I said, I know. She was like, you have to help her today. These are the things that we deal with that are really hard to deal with. I mean, we deal with death more frequently than we'd like to admit, but these are hard.
It's very, very hard work at the front lines. It's easy to get anxious and depressed out there, but we have to keep in mind the larger purpose.
With me now is Christopher Ebmeyer. He's a physician assistant in Rochester, New York. Dr. Michelle Kars is a pediatric anesthesiologist and the co-founder of Mask a Hero. Don Morton-Rios is the president of the National Commission on Certification of Physician Assistants. And Kate Walton is a registered nurse in the emergency department at the University of Wisconsin Hospital in Madison. Thank you all so much for taking the time at this critical moment to speak with us. Christopher, I want to talk with you. Working in New York City, tell us, what are you seeing day to day as you treat COVID-19 patients?
We're seeing an uptick in the amount of patients, obviously, that are being admitted to the critical care unit at our hospital. Obviously, we're running with the right amount of equipment at the present time. We're still waiting for that surge to happen within the next 5 to 7 days.
Don, I'm sure you are hearing a lot from your members. What are they telling you about their biggest concerns?
PAs across the country, 139,000 PAs, are working really hard to help fill the gap and to take care of a growing number of patients. What I'm hearing is that they're working long hours, extra shifts. They're worried about their patients and they're worried about their own safety. They're acquiring their personal protective equipment to ensure that they're safe and that they're able to provide the best possible care for their patients. And it's taking a toll on them. It's very stressful, and it's different from everything else that they've experienced in the past. This is unique.
Dr. Kars, it is different. It is unique. You are an anesthesiologist in New York City. You are also a mother. Tell us what your day-to-day is looking like and how you're managing to care for both yourself and for your family.
So day to day, one of the roles of the anesthesiologist has been part of the care team that is placing these patients on the ventilator. And we are at high risk with these procedures because we are face-to-face with the aerosolized virus. We are in direct contact with the droplets as we're intubating patients. But we're also in this situation where we're coming together as a team, meeting various doctors and nurses that have been at the bedsides of these patients And we're with them at a critical moment where they are really getting sedated to be intubated. So we're acting as their family as well. We have providers that are holding their hands, comforting them, and we're doing everything we can in these emotional, very difficult moments. But this is what we do, and we know that we're just putting ourselves there for the patients.
Kate, obviously we're talking about New York a lot because New York is one of the epicenters of this virus. I wonder what it is that you're seeing in Wisconsin, and as you look at what's happening in New York, what the lesson is to you.
We're still in the build up here, so we haven't quite seen the volume, obviously, but we're watching closely New York and Seattle and things our colleagues are going through there. Here it's more trying to be prepared, trying to conserve as much PPE as possible, and really just watching the acuity of our patients get higher and higher every day.
Dr. Kars, for good reason, we talk about those who have confirmed cases of the virus. One thing we're not hearing as much about is those who have survived. So I want to talk a little bit about those numbers. According to Johns Hopkins University, over 230,000 people worldwide have recovered from COVID-19, and over 9,000 have recovered in the U.S. What have we learned from those who have managed to beat this virus?
So we are learning new things every day. This is evolving every day. And as we're exploring treatments, we're getting small studies from other countries, small studies from the US. We're hearing about the potential for plasma donations that was just approved by the FDA. And so we're evolving our treatment every single day. We are hearing from doctors and nurses, staff around the country of those successes. We are hearing about those patients that are, while small at this time, are coming off ventilators slowly but surely, but they have challenges ahead of us. So we are hearing that we're learning things. Our care is getting better. We're learning how to ventilate patients better. So as we learn more, we're only hoping for more success.
Christopher, we've heard a lot from nurses in New York, from nurses across the country about the shortages in protective equipment. Beyond that, how is the morale among healthcare workers?
Well, obviously, with the chance that we're going to be infected ourselves, it puts us in a bit of a vulnerable situation. We're not able to do what we'd like to do. Normally at a bedside, we'll have family members available to be with the patients, typically 24 hours a day. Unfortunately, with COVID-19, that is impossible just for their own safety. So we're sent into a situation where we're dealing with patients that are critically ill, that are going to be placed or on ventilators and are unable to interact with their family members, which takes the human component, if you will, or the family interaction out of healing from a critical illness. And it's very tragic. It's very heartbreaking at times, knowing that potentially we could be the last people that they are talking to.
Yeah, absolutely. We're going to talk about that a little bit later in the show, some efforts to ameliorate those concerns. I do want to ask you, Dawn, what is your main concern as you watch this all unfolding?
My concern is first of all for the safety of our providers. PAs are working really hard and they want to give their all. They're doing their best, taking care of a volume of patients that is unprecedented. They're seriously ill patients as well. So my concern is, one, for their safety and their well-being, their emotional and physical well-being, and also for the patients that they're caring for. PAs work really hard to connect with their patients. And like was just mentioned, part of our practice as PAs is to be able to talk with them, explain things to them, to the families, to help everyone understand what's going on. And because of the contagion, we're concerned and PAs are concerned, and they're not able to practice in exactly the same way that they ordinarily would. And that's difficult. It's an emotional toll that's very different.
Kate, what is Kate, what is the one thing you want people at home to understand about this virus and the way that it is impacting healthcare workers?
First of all, it's important that people continue to stay home and continue to stop the spread as much as possible, especially in places like Wisconsin where we haven't hit that peak yet. Second, that I want everybody to push their legislatures and our national administration to provide adequate PPE, to provide care for the people that are taking care of their family members, again, without family present, unfortunately. That's the reality here, too. So I want, push legislatures for more PPE, for paid sick leave and hazard pay for those of us in the hospital, and not just nurses and doctors, but, the people cleaning the rooms, the people serving the food, everyone who's at risk simply by virtue of their job, and the people that have to work and can't stay home unless they're sick, and then that don't have paid sick time if they do get sick. So we really need better leadership than we've had, frankly, across the country on our reaction to this, essentially.
Dr. Kars, I have about 30 seconds left, but I do want to give you an opportunity to talk about Mask a Hero very quickly. How can folks at home help?
Mask a Hero is a nationwide initiative to promote donation of PPE to healthcare providers that are in dire need. So we're a nonprofit. You can go to our website, maskahero.com. And for those states, there are multiple states who have it, including New York. You can come to Mask a Hero New York and help donate supplies to the workers that are in need. Thank you.
All right. Helping the helpers. Dr. Kars, Christopher, Dawn, and Kate, thank you all so much. Amid this national crisis, we learned overnight that President Trump is firing the Intelligence Community Inspector General, Michael Atkinson. Atkinson, you may remember, is the man who flagged the Ukraine whistleblower complaint that eventually led to the president's impeachment. He deemed the complaint an urgent concern that he was required by law to relay to Congress. For more on this development, I'd like to bring in Senate Minority Leader Chuck Schumer of New York.
Morning.
Senator Schumer, thank you for your time. The president said of this, "It is vital that I have the fullest confidence in the appointees serving as inspectors general. That is no longer the case with regard to this inspector general." Your response?
Well, we've had a great tradition in America that patriots speak truth to power. They tell them the truth, and America's been a nation of truth. This president has turned that inside out. When you tell him the truth, he fires you, whether it is Mr. Atkinson or the captain of the aircraft carrier a few days ago, Colonel Vindman, so many others. And let me just say, in terms of our intelligence agencies, Alicia, these are, they don't make movies about them the way they do about our members, the men and women in our armed forces, because what they do is secret. They risk their lives. They do so much to keep America safe. And to politicize it, to just say that somebody who was protecting that agency, as Atkinson did, should be fired because he told the truth, it's a dark page in American history.
What more do you see Congress doing in order to protect those who cooperated with the impeachment hearings?
Well, we're trying our best. It's the House more than the Senate because we're in the minority, but I know they're trying their best to protect them.
Okay, let's talk a little bit about COVID-19 currently ravaging your state and the need for protective equipment and the national stockpile. You're now calling for the president to appoint a senior military officer to oversee the production and distribution of critical equipment. How would that change the process that is currently in place?
Well, first, the process is not working. Just in the last day, I've heard from police officers can't get masks, nurses and healthcare workers who can't get the PPE, the protective equipment, hospitals who have said they can't get the ventilators. Our mayor and our governor, they're both doing excellent jobs. They have to spend time on the phone calling private companies and begging for this kind of equipment. Well, the good news, so it's not working at all. What the administration is doing is not working. There is a very good answer. It's called, Alicia, it's called the Defense Production Act. It was passed by President Truman during the Korean War. And it allows our military to mobilize both the production of needed resources as well as the supply lines, but also the distribution to send them immediately to where they're needed. New York would now be at the top of that list. And I am urging the president to invoke the Defense Production Act and put in place a military person who has a high up with real stature. And the military folks know how to do quartermastering. They know command and control. They know logistics. And this person should have the full backing of the president. No politics. Just go do your job, general or admiral, and make sure that we produce the materials and get them where they're needed. And I say this to the people not in New York or New Jersey, the epicenters right now. It's going to come to you. And if we don't have this system in place, you're going to find the same shortages of equipment, of tests. I spoke to one of my colleagues in Michigan, And they said they don't even have, one of the hospitals doesn't even have swabs, which you need to do the testing. So we need this to happen. We need it to happen immediately. The good news, I mentioned this to the president a week and a half ago. He said he'd do it, and then in a press conference he backtracked. I talked to him yesterday. People know the outcome of that. But last night I spoke to both Vice President Pence and Chief of Staff Mark Meadows. I spoke to them for a while about how this was so needed to get the supplies we need to fight this awful virus to the places where they're needed, and they took it very seriously and said they'd get back to me. I hope they can convince the president to do this, because this is vital. If we don't do it, lives will be lost, the disease will linger longer, our economy will be much worse.
Senator, already 3 relief packages. We know that there is one more focused on healthcare. What do you say to those who worry that the existing packages did not go far enough, did not do enough?
Well, they were a great start. We Democrats resisted the Republicans, and we did 2 watchwords: workers, not corporations, but workers first, and a Marshall Plan for hospitals, nursing homes, our healthcare infrastructure, the clinics and the CHCs. So it's a very good bill. It's $2 trillion. But we never expected it to cover all of the issues needed. And as this crisis looks worse and worse, we're going to have to do more, and we're going to have to think in big and bold ways. Anyone who thinks this is the last package, I think is in Never Never Land. We're going to need a larger package, a bigger package, a bolder package to follow up on the good work that was done in COVID-3.
Senator, we're going to hear from the coronavirus task force at about 3:30 today. What's the number one thing you expect to hear, want to hear from that task force today?
Well, the number one need we have in New York are all of these supplies, whether it's masks, whether it's swabs, whether it's ventilators, whether it's protective equipment or other things. I hope I would hear from this task force that they'd recommend to the president to invoke the DPA. That's the quickest, most effective way to do it. Our military knows how to do this. They do it in times of war. Let's face it, Alicia, this in a very real sense is a time of war.
All right, Senator Schumer, thank you so much for your time.
Nice to talk to you.
The coronavirus is claiming lives from all walks of life. However, it is taking a far more devastating toll on some minority communities. A ProPublica analysis points out in Michigan, where the state's population is 14% Black, African Americans made up 35% of cases and 40% of deaths as of Friday morning. With me now is Rashad Robinson. He's the president of Color of Change, and Jess Morales-Raqueto. She's the political director of the National Domestic Workers Alliance and executive director of Care in Action. Thank you both so much for your time. Rashad, I want to start with you. The Washington Post points out that while data about the age and gender of patients is being gathered, there isn't any consistent information about race and ethnicity across the states. What's the importance of having that information, Rashad, as we continue to fight this virus?
Well, it's important to know where we're putting resources, how we're understanding how to fight it, how we're looking at preconditions and other things that may exist in some communities or not, but also that we have a record for how these resources actually move to the communities most needed. As part of actually collecting that data, we need deep privacy protections. Right now, we're watching as big tech and other sort of industries, even the sort of government, are trying to use aspects of data collection to, I think, invade various areas of privacy that we've held very dear. So while we do need to disaggregate data so we have real information on different races and how it impacts, we also need to have privacy protection. So on the back end, we don't have all sorts of data that can be used against people when they are applying for loans or trying to get a job, or all sorts of other ways where we have seen privacy protections really hurt communities of color in particular.
Jess, New York City is a hotspot. The latest data released by the city finds New York City's most impoverished zip codes have higher instances of diagnosed coronavirus patients. What makes these communities more at risk?
I mean, all of this is exposing the racism in our system. You know, I've heard people say stuff like coronavirus is the great equalizer, but I would argue it's actually quite the opposite. Coronavirus is hurting the people that are already hurt. and left out by our system. African Americans and Latinos. At the Domestic Workers Alliance, we've been surveying tens of thousands of workers, and we've found that over 68% of our folks have lost 100% of their income. Rent was due last week, and they didn't know what to do because they had no income this month.
Rashad, on Friday, the Bureau of Prisons announced that 5 federal inmates have died from the coronavirus at a Louisiana correctional facility. What more needs to be done to protect these vulnerable populations?
Well, both in prisons and in jails, we need a very deep strategy to release people. You know, the fact of the matter is that the social distancing is impossible inside of prisons. People are 2, 3, 4, sometimes 6 times inside of a cell. People are bringing the disease inside, whether they are correction officials or whatever, and then people are going back out into their communities. Oftentimes, correction officers are come from poor communities, disproportionately Black and brown. Here in New York City, where I live, we're watching the numbers go up in Rikers Island. Many of the people in Rikers Island have not been convicted of anything. They are oftentimes there because they are too poor to pay their bail. What is happening in our prisons and jails is a human rights disaster, and it will track right back to Black and brown communities. It's why at Color of Change, we have organized over 70 organizations through a platform called Humane Response Outbreak. We've built a larger platform called the blackresponse.org. And the blackresponse.org is a place where all around the country right now, we have local organizations and advocates running campaigns targeting district attorneys, pushing governors to start having a very clear release strategy for people who are older, for folks who have a little bit of time left on their sentence, for folks who are there and haven't been convicted of anything. The fact of the matter is it will stay inside of prisons and jails for a long time, and it will continue to track back to our community. We also need a plan connected to that around housing. So we have places for people to go. All of these issues are exposing deep choices that we have made in our society, in our country, about who we value, where we put resources. This is a product of the Trump economy. It's a product of choices that have been made. It's not unfortunate. It is unjust, and it has been manufactured all around this country. And we're going to see, just like in Hurricane Katrina and just like in so many other issues, the decisions that have been made about where we put resources, about how we treat people, will have deep consequences. But unlike Hurricane Katrina, there will be Katrinas all around this country, and it will be impacting our society for years to come. And prisons are one of those places where we oftentimes put people and we try to pretend like they're not there. For all of us, we have to be concerned about those who are behind bars. We have to be concerned about their families, and we have to be concerned about the people who are working in those institutions if we are concerned about ourselves and if we are concerned about our own communities.
Rashad and Jess, thank you both so much. Up next, more on the federal response. I'll talk to former Health and Human Services Secretary Kathleen Sebelius about what the government should be doing differently. At least a dozen experts told NBC News this week that the federal government's failure to provide a comprehensive strategy to fight the coronavirus will wind up costing unnecessary lives. It was a sentiment echoed by New York Governor Andrew Cuomo, who told my colleague Rachel Maddow that the lack of a robust federal response probably made things worse in New York.
Nothing comes close to this in terms of the need for intelligent, rigorous, muscled government to respond quickly and smartly. What keeps me up at night is not just the numbers, but a deep sense that it didn't have to be. It didn't have to be.
Let's bring in Kathleen Sebelius. She's a former Secretary of Health and Human Services under President Obama. Secretary, you just heard Governor Cuomo there. Do you share that sentiment that it did not have to be this way?
Well, I share the sentiment that for too long we were in denial, led by the President of the United States, who ignored his security briefing, ignored his scientists, paid no attention to what could be seen as a terrifying pandemic that spread very easily and is Dr. Fauci likes to say, efficiently, and was going to be very difficult to contain without a vaccine. So yes, what could have been would have been a much better response. But we are now where we are without still robust federal intervention. I live in a state of Kansas, right in the middle of the country. Our cases are rising rapidly. We are certainly not the hotspot that New York is. Our governor has requested supplies 3 different times in March. None of those supplies have been delivered. We still do not have enough test kits to even know about healthcare providers and are they safe and secure to go to work. We're a state, unfortunately, blocked by Republicans in the legislature, not expanding Medicaid. And we've had a government walk away from the opportunity to open up health insurance for individuals who may want to purchase health insurance. So we're having an economic crisis and a health crisis, and still Republicans are playing their old tune. They really don't want people to have affordable health care. They really are not willing to see government as the only backup to states and local leaders who are doing their best to try and contain the virus within their borders, but they can't equitably distribute materials. They can't purchase things from overseas the way government can. And we don't have a government right now that is transparent and open and equitable to all states.
Secretary, I want to play you some sound from this past Thursday, the president's son-in-law talking about the national stockpile of PPE. Take a listen.
The notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use. So we're encouraging the states to make sure that they're assessing the needs, they're getting the data from their local situations, and then trying to fill it with the supplies that we've given them.
Secretary, what do you make of this?
Well, it's just flat out not true. I have read that now the statement about the stockpile has been rewritten so that Mr. Kushner's comments are not seen as flat out lies. But that is not what the national stockpile is about. It is about the national government, the federal government, with all the muscle that it has, mobilizing medicines and materials. And when states and local governments cannot access those materials, they draw on the national stockpile. We have a situation where everybody is looking at the same time for that stockpile. It was not replenished. It was not kept up to date. But the idea that Jared Kushner would suggest that somehow states are on their own and that that stockpile is meant for the federal government, what is the federal government doing with a stockpile if it isn't to back up state and local governments? That's how disasters work. Local leaders call on states, states then call on the federal government. And the federal government has dropped the ball at every step along the way and is still failing to be in the leadership, in the muscle position.
Secretary, perhaps to that point, House Intelligence Committee Chairman Adam Schiff proposed the establishment of a bipartisan commission with subpoena power to investigate the administration's pandemic response. Do you think that's a good idea?
I think it's a very good idea because I got to tell you, until we have a vaccine, this is not over. We hopefully will get a handle on what may be the first waves in some states, but likely to have second and third waves. We have to believe that the government is transparent, that the government is available for all of us, that the government will not play favorites. We still have a president calling governors names and pointing out that people have to be appreciative to him or they shouldn't get their calls returns. That's a terrifying leadership vacuum in Washington. And once we have a vaccine, we have to believe that that will be equitably distributed, that the government will have a national plan to vaccinate the entire country as quickly as it can happen. Right now, none of that is very certain until the federal government really steps up and does its job. So investigations are very good. Congress should actually mobilize as much muscle as they can and call on the government to use the tool. There are health care personnel throughout the federal government in the Commission Corps who have not been mobilized. There are assets that can be drawn upon in the Defense Department for logistics. They have purchasing power and reach globally that none of the states can possibly replicate or duplicate. So this is still a failing federal response.
Secretary Sebelius, thank you so much.
Sure. Glad to be with you.
Let's bring in Sahil Kapoor. He's an NBC News national political reporter. Sahil, I want to talk to you for a minute about Jared Kushner and Jared Kushner's role in all of this. His group is working with FEMA to oversee distribution of medical supplies. There's a concern that he's violating federal laws and confusing the chain of command in the process. Why is he in charge of this?
Well, I mean, Jared Kushner obviously has an important job in the White House and the administration. He tends to get involved sometimes on an unofficial level on things here and there. The reporting suggests that Kushner has developed a lot of confidence in his own understanding of the federal government, so he wants to take a bigger role in this. Again, the reporting suggests that he's doing what he tends to do in these situations, which is look for private-public partnerships, try to look at what Silicon Valley and private companies are suggesting, and see a situation there. But it's not off to a good start, as you just pointed out. He made a claim about the medical stockpile that was factually inaccurate, and he's getting some criticism of that. So the answer is it's not really clear what precisely his role is going to be.
Sahil, you've been doing some great reporting about seniors and their ability to get their checks. Can you tell us what the latest is?
There was a lot of confusion, Alicia, when the IRS came out with the guidelines early on as to how seniors would get these $1,200 checks, because a lot of seniors don't make enough money to file tax returns. And the IRS suggested that they would still have to file some sort of simple return in order to be eligible for the money. As you can imagine, a lot of seniors were confused and kind of worried about that and worried about what they do. Later in the week, the IRS backed off that guidance, reversed itself, and said seniors do not need to file a tax return. So if you're listening to this and you're on Social Security, you don't need to file a tax return. The IRS will use your SSA 1099 form. It's advisable to have direct deposit information, bank account information uploaded, because that's the best way to ensure that you'll get your money as soon as possible. For other non-tax filers, the IRS is expected to be setting up a system soon. So you can put basically your filing status, number of dependents, basic information for the IRS to be able to get that money out as soon as possible.
All right, Sahil, thanks so much. As the battle to contain the coronavirus outbreak rages on, another battle for reproductive rights is simmering just beneath the surface. The Guardian writes, 6 conservative states, Indiana, Iowa, Mississippi, Ohio, Oklahoma, and Texas, have categorized abortions as non-essential, except in very limited cases, effectively banning access to the procedure during the pandemic. Federal judges have stopped the bans from going into effect in most of these states. However, on Tuesday, an appeals court ruled that Texas could reinstate its abortion ban. Joining me on the phone is New York Attorney General Letitia James, who's leading a coalition that's fighting to ensure women will continue to have access to safe abortions. Attorney General, why fight this fight in this moment?
Let me just say that on March 23rd, the governor of Texas issued this executive order banning abortion services unless the life of the mother was in jeopardy. The executive order sets forth criminal sanctions up to $1,000 and the imprisonment up to 180 days for individuals who violate this order. The lawsuit was filed by the Center for Reproductive Rights, Planned Parenthood, and the Lawyering Project in the district court for the Western District of Texas. That judge issued a TRO basically stopping the ban. The next day, Texas appealed to the United States Court of Appeals in the Fifth Circuit, basically halting that decision and effectively reinstating the ban. Yesterday, I, along with 18 other states' attorney generals, we filed a brief in opposition to the state of Texas and in support of reproductive freedom and in support of women. The reason why is that these prohibitions basically hinder, they block the exercise of a woman's constitutional right to an abortion, which is enshrined in Roe versus Wade, 50 years. And there is no exception in Roe versus Wade for national disasters or national pandemics. It is a constitutional right. And the state of New York cannot use as a pretext that this is basically an attempt to conserve public health equipment or minimize the use of PPE, when everyone knows, most individuals know, that most abortions do not require PPE and are not performed in a hospital. They are usually performed in a doctor's office. And by blocking this critical service, some women, mostly women with means, will travel to other states, increasing the likelihood for community spread or furthering this transmission. And so this pandemic should not be used as an excuse to deny, restrict, limit, or block a woman's right to control her body. And let me also say that poor women who cannot travel will resort to back alleys. And so it's really critically important that Texas, as opposed to issuing this ban, that they join me and others to increase access to reproductive health by, again, accessing telehealth services and telehealth medicine, and also access to the medical abortion pills. That's what Texas and all of these other states should be doing.
I do want to ask you about that, Attorney General, because you have urged, along with other attorneys general, the FDA to allow women to access a prescription abortion drug by mail so they don't have to risk leaving their homes. What is the pushback that you've gotten from the FDA?
So I, again, joining, co-signing with a number of my colleagues across the country, we have asked the Federal and Drug Administration, as well as the Health and Hospital Services, to basically remove these designations, not to enforce and or to basically exercise their discretion in allowing for these abortion pills. They have to remove the designation known as the risk evaluation and mitigation strategy, which effectively blocks access to this abortion pill. The only way to access this pill is, one, an individual has to go to a clinic and the medicine has to be handed to you. Two, your health care provider has to be registered with the drug manufacturer. And three, you've got to go and obviously be consulted by a medical physician. All of this can happen online. We can utilize telehealth services. We do not have to risk we don't have to risk ourselves to this pandemic. We can just, again, get a prescription which can be sent to us electronically and take these prescriptions in our homes. These are safe and effective methods of abortion. Over 2 million women have used it. It's a practice which is supported by the American College of Obstetricians and the American Medical Association and others. And so we are urging the federal government to recognize abortion and reproductive services as essential healthcare services to women, and not block us, not get in the way, not treat us like second-class citizens, and again, not intrude or trespass on our fundamental right to reproductive services.
New York Attorney General Letitia James, thank you so much. We'll be right back.
Thank you.
Hospitals across the country have enacted visitor restrictions in order to limit the risk of exposure to COVID-19. This barrier has led families to feel helpless, and their sick loved one enters the hospital without a familiar face by their side. Hospital staff have taken on another role as stand-in family members, showing affection for dying patients in their last moments.
It's heartbreaking as a nurse to know that you are that person's everything. And sometimes in their last moments, the weight of trying to fill the shoes of the people who can't be there is really heavy.
With me now is Sarah Odell. Her project, COVID Tech Connect, is helping to virtually connect patients with their families. Sarah, thanks so much for being with us. You have more than 40 hospitals who've requested these devices. How are you helping to meet that demand?
Thank you for having me. So we organized COVID Tech Connect so that we could gather devices from both technology leaders as well as make purchases of these devices and get them into the hands of these departments that need them. We're hearing from both nurses and doctors that they don't have enough devices capable of making video calls. And because of that, they're not able to facilitate these goodbye conversations.
Your team's GoFundMe goal is to raise $1 million to help purchase over 10,000 smart tablets to give to medical facilities in most need. If someone is watching and they want to help, they want to be a part of this, what can they do?
So the easiest way to support us right now is to visit our GoFundMe, and it's called the Dignity Project. And every dollar that we raise goes to both purchase those tablets that are in need, as well as cover all of the shipping to the hospitals. And our goal is to reach as many hospitals as possible. What we're hearing from hospitals is as few as 15 devices can make a huge difference for them in getting these devices into circulation so these video calls can be made.
Sarah, there are so many needs right now. We hear about ventilators. We hear about the need for PPE. Why should this also be one of the priorities?
It's true. There are no shortage of shortages right now. And this one really spoke to me and the group that we're coordinating with and so many of the people who have been donating, because these goodbye conversations are so important for not only the person that is passing away, but their friends and their family, and also the healthcare providers. As these healthcare providers are pushed to their limits and are working beyond their normal hours with beyond normal emotional experiences, being able to have these conversations is a moment of healing that I think we all need right now.
Sarah, thank you for your time and thank you for everything that you're doing. That wraps it up for this hour. I'm Alicia Menendez. I will be back at 2 p.m. Eastern tomorrow. My colleague Joshua Johnson picks up our continuing coverage at the top of the hour.